Whoa. It's like so much release right there.
So we have Pirouz here today. What do you want to work on?
There's a lot of tension in my lower back.
Okay.
I'd say I feel like stiff shoulders a good amount of times, and my neck.
Okay.
You know, it's a lot of tension there too.
Now, when you turn your neck right now, left and right or back and forth, try doing that. Is there one spot that you could point to and say, well, I feel it right now, or it's just general stiffness?
I'd say just general stiffness.
Now do the same thing. Go forward, and feel that lower back and come back up and lean back. Do you feel any tightness today that you could?
Definitely right here.
Turn all the way around so we could see. So you're definitely feeling it here today.
Yeah, exactly.
All right. So go ahead and put your nose here. So you're going to lie on your belly.
Okay.
And we're going to just start looking at you, okay?
All right.
So the first thing I did is just to see, and your legs are pretty even, so I'm not going to use that as a focal point.
Okay.
I'm going to put your arms back alongside, but I do want you to lift one leg at a time. So you're going to lift this leg up in the air and put it down, and lift this leg up in the air and put it down. And does one feel tighter to lift or tougher to lift than the other? Sometimes they are, sometimes they're not.
I'd say the left one a little bit.
Let's do it again, and you
right.
determine it because it's it's you and your own body.
Left one for sure.
Okay, so this time when you lift the left one, take your thumb or your finger and go, that's the spot, or that's the spot. So do it in the middle of the lift. Yeah.
Right here.
Okay, good. So that helps. So you're pointing to your lower lumbars, L4, L5. That's the most common spot. People will feel it when they lift that leg up. Other spots will feel the SI joint, sometimes lower on the glute, sometimes even the hip socket, and sometimes in the front, and sometimes the hamstring. So I see all different areas that people point to as they feel that grab of tightness. But I think almost 70% of the time it's going to be people point to lumbars, and 30% of the time all those other spots combined. Okay. So you pointed to the classic spot.
I can definitely feel it right now.
Yeah, and I'm on the spot.
Yeah.
So I'm going to use the activator. I'm going to just tap down into it. And this doesn't feel like much, but it's kind of cool because if you're accurate and you get on the spot of the vertebra, that can make it rotate a little bit. And it's very subtle. It's only moving a millimeter or two. But a millimeter or two is a lot with a nerve and a lot with the biomechanics of that area. Plus, it does fire into the receptors, the mechanoreceptors and the proprioceptors and the nociceptors. So now lift that leg and see if it's starting to change.
I could definitely feel it get a little better.
Okay, so we're not done yet.
Still some tension.
So now I'm going to do some with the with this type of thruster.
That feels pretty good.
Yeah. This is a little stronger, or it feels a little more tapping, right? Try it again.
Yeah, it's much, much better.
Much better. Okay, getting closer. Where do you still feel it? Did it move, or is it the same spot?
Let's see.
You use all my gadgets on you.
I think it's good on this now.
All right, it's good. So let me just do another second. This is the hypervolt. Now try the leg.
Yeah, that's good now.
It's pretty good, right?
Yeah,
You're ready to kick me when you stand up. No, please don't.
I won't do that though.
All right, good, good. So next thing I'm going to do is have you lie on your back.
All right.
Sounds kind of cool, right?
That was great.
Now notice I didn't even pop you yet.
Yeah.
That's just like muscle work. And a little bit of, we did move the spine a little bit, but just like little increments.
Yeah.
And so what's cool is that there's subtle stuff that works well, and there's deeper, stronger stuff that works well. And if ever I have someone that comes in that's scared of stronger stuff, I say, no problem, let's just do light stuff. Let me see how far I can get. And very often I don't do any pop, not very often. Maybe 5% of the clients, the patients that come in, I'll just do only light stuff, and they get great results.
Is the machine considered light stuff?
Yeah, because I wasn't cracking and twisting and
manual
so
work would be.
Let's say you send someone in and goes, I'd see him, but I don't want any cracking. I don't want him cracking me. I don't want him popping me. So I can usually help those people tremendously.
Yeah.
But it might take a few more visits sometimes. Sometimes it doesn't. But it's cool to have other tools in the toolbox.
For sure.
Oh, wait.
Those are definitely helpful.
Yeah, so this time I'm going to put this around, And I'm first gonna show you the stretch and see if you feel like it feels nice for you, okay? So this will catch on the back of your head a little bit. Let the weight of your head fall. So this is the stretch. You feel it?
Yeah,
just stretch it straight. It just feels pretty good, right? So take a big breath in, and we're gonna do one now, okay? And blow it out.
Wow. Oh my God.
What did you notice?
Well, I felt a big crack, but more so like, I guess the spine's elongating in that one.
Yeah.
So it feels great. Wow.
So wait, we're gonna do another layer now, okay?
Sure.
This time with the hands. I'm gonna tilt your head this way.
Whoa. It's like so much release right there.
It's pretty crazy, right?
Amazing. Wow.
Good. So now I'm gonna have you lie face down.
Okay.
Put your nose right there.
My head feels lighter.
Yeah. You're gonna be able to really move your neck well. Back to center.
Good.
Lie on your side facing me.
Okay.
So your both legs go straight, then pull up only the top knee. Tucks right there. Let me pull off. You off the shoulder so your shoulder's not jammed under you. And let this fall a little bit. Got it. Good. So come to the other side. Pull up this top knee. Good. Actually, scoot your hips a little closer to the edge, getting the shoulder out. All right, lie on your back. Now move closer to me.
Okay.
I'm gonna reach under and do one last one I saw in the mid back.
Sure.
Turn your face this way, all the way. Just your face, this way.
Oh, that way? Okay. Wow. Oh my God.
It's pretty good, right?
I'm a new man.
Wait, stay
Oh,
there.
there's more.
I just want to,
Okay.
because your hips get tight, I want to pull on the hip a little bit. Good. And then let me look at your wrists. I'm going to have you come stand for a minute, okay?
Sure.
So you're going to stand and face me. Let your arms hang down. A little bit, but nothing that crunchy in there. That's it, man.
Thank you so much.
Thank
Doc.
you.
Appreciate it.